Just wanted to give a quick intro to the video. So yesterday I was at a tech conference where Cuban spoke, and about 5 minutes in, I was sitting there thinking, dang, I wish this was recorded. So I pulled out my phone. It was just a voice recording. You'll have to be forgiving because it's not the best. I put it into like a AI voice enhancer, but it just didn't sound good. It makes him sound nasally. It kind of cuts out his voice. So you'll get used to it as you listen to it, but the content is really, really interesting. One other thought I had was the whole time I just kept wondering, man, how did they get Mark to come to Salt Lake? Like, what a big name. How much did they have to pay him? But as he spoke, I realized that he wanted to come because he cares so much about the topic that him and Chris spoke about. And the way I understand it is Chris is like the person he needs to get in touch with, or somebody he wants to speak directly to get his message across. So hope you can be forgiven of the audio. I was like 10 rows back, so I wasn't too far away, but yeah, it might be kind of loud when people clap, but it's super duper interesting. So hope you enjoy it.
You're always willing to continue to push forward. That's what I've seen as the common bonds. When I see companies from Shark Tank that, like there's times on Shark Tank, and I know I'm not your favorite shark anymore, but when Mr. Wonderful will be talking and I'm just so bored.
You call him Mr. Wonderful?
No, I call him, you don't want to know what I call him. But I'll be so bored, I'm like, I'll just do a deal. All right, just to end the pitch. And
you'll do the deal just to end it?
Yeah. So that's where I get stuck with my worst deals. And the commonality there is they want shortcuts. They want to be on another TV show. The minute one of them says to me, okay, what TV shows can you get me on? I know I'm in trouble. Because they're always looking for a silver bullet. I just have to hire this right person. If I get the right marketing person, if I bring in a president no, it's your company. You have to figure it out. So the entrepreneurs who are not willing to just do what they have to do to figure it out, those are the ones that typically fail.
Well, that's fantastic advice. Thank you I hope you're taking notes on that for all of my students out there. Chris, you've been now in government for a year. I don't think this was your plan. You're like, I'm gonna go be a government guy. But you're now in the room. We had a call a few months ago, and can I say that what Trump called you before he knew your name? Okay. He called Chris the Mormon assassin. He didn't know his name, but he called him the Mormon assassin. Can you talk a little bit about Inside Baseball? Give us the behind the scenes of like what your life's like.
Who did you kill?
No one. We didn't.
Okay.
It's true. The president likes his nicknames, and that story came because so I lead Medicare, as we've talked about, and I do a few other things outside of that. And prescription drugs prices don't just bother Mark. It turns out they really bother the president. So see, there's common ground. And he's angry about it. He was angry about it in Trump 45. And I think he dropped prices, the prescription drug price index, by like 0.1%. It was like the first time it had gone down, and that was it. And he was really proud of it, but turns out not enough, and he wanted to do more. And so he dug into the issues, and interestingly, he's attacking prescription drugs from a different vantage point than Mark is. Mark's going after the middleman. Mark's eliminating all of the unnecessary steps to go straight to the consumer, and he's using sunshine as the great disinfectant to drive transparency. And that does account for a bunch of our prescription drug costs. But the president is going at it from a different perspective. He realized that we spend 3 times more in the United States than other wealthy countries do on the same drugs. Same box, same drugs, same manufacturing plant, same manufacturer. And there are reasons for this. We have a competitive marketplace. Other countries buy drugs centrally. You're the United Kingdom, you have a nationalized health system, you show up to Pfizer or Lilly and say, here's the price I'll give you for your drug, take it or leave it. And by the way, they're okay leaving it and not giving that drug to their citizens. And as long as they offer a price that's just above the marginal cost of production, then usually those countries will take it. And there's a reason they'll do that, which is we fund 50% of global R&D for pharmaceuticals and about 65% of revenue and profits for the industry. And we've habituated the world to paying for this. So he was angry about this. So the president puts out a press conference on most favored nation drug pricing. And I got tasked with being one of the lead negotiators on this, going and figuring out how it was that we were going to get all these pharmaceutical manufacturers to show up and voluntarily lower their prices. And
that sounds like a really fun meeting.
I hadn't spent much time with the president, so he does this press conference, and then it's right before he's going to Saudi Arabia. Remember that Middle East trip last year? And so I'm with Oz, and we go back to the Oval, and Susie, his chief of staff, is sitting there. Secret Service is outside. Marine One is fired up on the lawn, ready to take the president to Andrews Air Force Base to get on Air Force One to fly to Saudi Arabia, and the president's in the bathroom. And so he does his thing, and he comes back into the Oval, and he sees me, and he shakes my hand, and he keeps walking, but he asks a question in passing. And I answer the questions about prescription drugs, and that leads to another question, and all of a sudden you can kind of see the schedulers freaking out, and Susie's eyes roll just a little because now everybody knows we're going to be off schedule. And he starts asking questions about prescription drugs. And in that moment, that was the most important thing he was going to do, which is a really important thing about him. He is a very present individual. The thing he is doing in the moment is the thing he is focused on. It's incredible. So anyway, Oz knew that he had these Bibles. It's the Donald Trump edition Bible. It's leather-bound Bibles. And Oz, knowing that I'm religious, says, hey, Mr. President, show him one of the Bibles. Now the schedulers are really freaking out. There's a runner in the room, and the president says, hey, go get a Bible. And so he starts to walk, and the president yells out, run! So the kid takes off, goes and gets a Bible, comes back, and he's like, here, I'll sign it for you. So he sits down at the Resolute desk, and he takes out a big Sharpie marker, and he starts drawing his name on the cover of this Bible, and he's talking to me. I'm standing right behind him. Oz is like, go stand together, I'll take a picture. Oz is amazing that way. He never fails to document an opportunity. And the president says, are you religious? And I said, yes, Mr. President. And he says, what are you? And I think I'm trying to decide what name I'm going to give him. And he's like, I'm Mormon, sir. And he's like, whoa, you're really religious. So he's like, here, you'll need this. So he gives him the Bible. And then he just knew me as the Mormon. And so that was it. And he'd be checking in all the time with Secretary Kennedy or Dr. Oz or others and saying, like, how are we doing on MFN? Like, literally almost daily was calling or texting on this issue. He wanted progress on prescription drug prices. And he said, well, who's working on that? And like, oh, the Mormon's working that, sir. And like, oh, good, he's a killer. So that was it. And it took a little bit until we started rolling deals out, and then I started speaking at press conferences in the Oval Office, and then he got to know me, and then we've been working on other stuff since.
No, that's fantastic. Thanks for kind of telling that story. I mean, Mark, you've been in front of Congress a few times now. You're pretty active in terms of Twitter. I tried to read all of your healthcare tweets, and it wasn't one or two. It's a few,
Thousands.
hundreds, thousands.
Close.
As you've really dug in here, like, what are your big learnings as like what you hope to see different, like what you want to change, like what is the world you're building towards in terms of healthcare?
So, Chris was just talking about most favored nation pricing and the difference between the prices in England and everything else. The one difference between all those countries in the United States, we have PBMs, pharmacy benefit managers. They don't. And those PBMs introduce all that extraneous cost that pretty much makes up the difference between the prices that they'll pay somewhere else negotiated by one entity versus here. And those PBMs, the biggest ones, own or are owned by the biggest insurance companies. And the biggest insurance companies are so big, they have 2,600, give or take, subsidiaries. That's unheard of.
That is unheard of.
They do $200 billion in intercompany transfers because they have so many affiliated companies. And the reason why that's important is, despite Chris's amazing efforts to cut drug prices 1,500%, the problem is that these big insurance companies have more control than Chris or President Trump have over prices. Because if they don't make money from the PBMs, because Chris has cracked down, they'll just move it somewhere else, right? So you'll see fees instead of rebates. You'll see consultants instead of primary costs. You'll see higher prices for specialty medications. You'll see, new per member per month fees so that they can then move to rebate-free offerings. They know how to game the system faster and better than we know how to respond. And I'm generally a libertarian, but the reality is you have to break these companies up. They are the AT&T of 1984, or the Bell companies of 1984. The reality is they have so much control. If you made them divest all their non-insurance assets, costs would drop like a rock. And so hopefully Chris will go back, or whoever's watching in the White House, and tweet or True Social to Pam Bondi and say, that jerk Cuban, he thinks that we could, go figure it out, Pam, go figure it out, because if she does something, healthcare costs drop like that, immediately.
Pam's amazing, and she is, I think, doing some pretty interesting things. That was a perfect tee-up, though, which is you should pull out your phones. Last night, the president launched, I have to pitch this, TrumpRx.gov. So now there are 2 sites on the internet with transparent, postable lists of prices, exactly what you're going to pay for a drug. And this is on branded pharmaceuticals versus more generic pharmaceuticals. And it's using most favored nation prices. So if you're trying to grow your family and you're struggling with fertility right now, you go to TrumpRx.com and you want to buy the series, the cocktail of drugs to help with an IVF cycle. As of last night, your price just went down between 40 and 68% per cycle on the drug costs, based on most favored nations. We want more babies. We want bigger families. If you're on a GLP-1 right now, you were paying $500 in the cash market. If you were on commercial insurance, it was paid $800 or $900 a month. You can buy a GLP-1 pill straight from the manufacturer now for between $149 and $245. The price is trending. Like, these are material. They will, and this is the first drop. There will be many, many more that hit as drugs integrate. Now, it's a cash pay market. It doesn't include insurance yet. This is part of the president's great healthcare plan. He's calling on Congress to codify this for everyone who does direct-to-consumer sales, for the exact reasons that Mark is talking about. With a lot of transparency, if you want to go buy your drug as a consumer, wherever you want to buy it, find the lowest price and buy it. And then let's have it count towards your deductible and your accumulator with your insurance coverage. It'll still cover. And right now that's not legal, it's not allowed. We want it to be the way. And so that is a core pillar of what the president's called on Congress to ratify as part of this recent plan.
Can I give you a little bit of a hard time?
Give me a hard time. We'd expect nothing less.
I know, it just got to get, it can't be all of this. So on the IVF stuff, phenomenal, right? There's nothing that compares to it. But if you go to CubanRx.com, because it actually just points to costplusdrugs.com. But of the 40-day release, there's 15 or 20 that actually have generics available to them. And so there are certain products that the branded might cost $200, which is still far less than it used to if you actually need that. But the generic equivalent might cost $6 or $10 or $12 at costplusdrugs.com. So definitely go, if you need a branded version, definitely go to TrumpRx. And let me just say, we're going to be working with them. I hope, we have an API of all of our prices.
Oh wait, what? What was
that?
Yeah. One more time?
I hope. So I'm a supporter of TrumpRx, but I just got to say, they cut costs, reduce price of brands 500%, 1,000%. Cuban RX, 1,500%.
This is fantastic. Thanks, guys, for letting us see all the ways that we can change and get better. I think one of those things that's really hot right now is around the fraud and some of the ways that people are gaming the system. Chris, we talked a little bit about your trip to LA. Would you maybe share a little bit about what you experienced as you and Dr. Oz went there, and what's happened in Minnesota and what you're seeing now? And it's not just individuals. There's like an organized element to this, and I think it's important for people to understand.
Yeah, and maybe before I jump to fraud, waste, abuse, if it's okay, I can give you a little bit of a background on why I'm sitting here in this seat right now and what we're focused on as a priority. Because I think you deserve to know. You should know what we're working on and why. And this goes back to your origin story that I didn't reference previously, but this is personal, and it's personal to all of us. I'm guessing, actually I'm curious by show of hands, in the room, how many of you are in healthcare? Yeah, like some, not a lot, right? How many of you care about your health?
About your what?
Your health.
Your health, okay.
How many of you have had, personally or a family member, lose their health? Yeah, so you should care about this. And here are the stats. This is why this matters. This is why I begrudgingly took the job, candidly, when the transition team called in September. Right now, we have about a 65% chronic disease rate in the country. We have about a 45% polychronic, meaning people have 2 or more chronic diseases. About 30% of Americans are diabetic or emergent diabetic. About 75% of us are overweight. About 40% of us are obese. So we are objectively the least healthy we have ever been as a country. And it's actually kind of hard to be healthy. We make it difficult. This is Secretary Kennedy's MAHA agenda, Make America Healthy Again. We have 10,000 plus, I like it. We have 10,000 plus additives, emulsifiers, and dyes in our food supply. The FDA has sanctioned this. So a Medicaid mom of 2 who finishes her shift and goes out to the grocery store to pick up some food on her way home to her kids, why should she have to flip every box and look at all the things and see if it's okay? And gosh, I don't know what that is. To wonder if she's poisoning her children. Why should she have to wonder? Why is it that I have 2 kids that actually have chronic diseases? Like, we healthy, we've got resources. These are the questions we're asking. This is the question Secretary Kennedy is asking. Why are we so sick? And then there's the financial side of it, which is I think what spurred you into this, which is we spend about $15,000 per capita on healthcare in the United States right now. It's more than we have ever spent in our nation's history. Think about that, $15,000 per year per citizen on healthcare for the privilege of being less healthy than we have ever been as a nation. Healthcare makes up 20% of GDP. It grows twice the rate of GDP, and it is the only net negative productivity industry in the entire economy. So every dollar it grows crowds out productivity. It crowds out a better way of life. It adds no value to humanity. It sucks resources down. And so make no mistake, by the way, it's the #1 cause of personal bankruptcy in the United States, and it will be the cause of sovereign insolvency if we don't do something about it. So anyone in here who's thinking about having kids or has grandkids should wrestle with the fact that we have inherited now a system that will objectively leave our children and our grandchildren worse off than we were. And that is morally offensive to me. It's morally offensive to the president. It's morally offensive to me. We can be up here and we can razz each other and we can disagree on the person that I work for, right? I support the president. Thank you. I want that tweeted out. I want everybody to tweet
I don't hate the guy.
At Mark Cuban.
I just find a better job.
At Poe. By the way, prescription drug prices just dropped for the first time since the Wall Street Journal has been keeping an index of prices this year.
There you go.
That's big.
Because somebody started this whole transparency thing about 4 years ago.
How many people live in the country?
You know, 40. Let's go there, right? First of all, let me say I love the MAHA stuff, right? And because we are poisoning ourselves. There's an organization called Food Fight USA that has been very involved in trying to correct this and working with the secretary that is fixing this, right? Working to fix this and take out a lot of those ingredients. So absolutely, that's very supportive. Number 2, all against fraud, waste, and abuse, for sure. Everybody is. But you have to realize that the biggest fraud is coming from the biggest insurance companies. And the reason we're spending more than everybody else is because of how much they steal from us. And I'll give you an example. All of us that...
By the way, the president agrees with you on that.
He's a smart man.
Yes, he is.
He agrees with me. But think about how we start the whole insurance journey. The insurance companies come back to your employer typically, and they say, here's a couple plans for you to choose from. And we all make a decision, and now it's a little bit more expensive. The premiums have gone up, so maybe we choose a lower premium and a higher deductible. And typically in this country, 40% of people can't afford a $400 bill and an emergency bill. So we go out there and we might have a $1,500 or $2,500, or like if we're on an ACA plan, a $5,000 deductible and a $10,000 out of pocket. What happens if you can't afford that? Effectively, if you can't afford your deductible, you don't have insurance. But here's the crazy part. If you want a loan for your small business, you can go to the SBA and there's a good chance they'll guarantee it. If you want to buy a house, you can go to FHA, and if you hit the appraisal and all that, there's a good chance they'll guarantee it. If you want to go to Brigham Young and just party like a madman, unlike me, you picked the wrong school. But if you want to go to Indiana University, national champions, and celebrate,
Congratulations, my friend. That's pretty epic.
we'll lend you money to go and party and drop out after one semester. If you get into a horrific car wreck and it's going to cost you $1 million or more and you can't even afford your deductible, you're SOL, you're out of luck. And that's just wrong. There's ways for us to deal with that by guaranteeing those deductibles, but wait, there's more. Because what happens now is those hospitals want to get access to all that insurance money. So you have a $5,000 deductible. Even though you only have $100 in the bank, they will loan you money so that you can pay for your deductible so they can go and get money from the insurance companies. But now we've turned that hospital into a subprime lender. And those lendings have turned into what the multiple hundreds of billions of dollars in medical debt that people have. So that's the first place that we create this instability in our system, because it's the insurance companies that don't want you to be able to afford your deductible, because if you can't afford the deductible, they just keep your premiums. But wait, there's more. When you talk about fraud, waste, and abuse, those insurance companies negotiate with all these big hospital systems. And thanks to Trump won and improving with Trump too, he deserves credit. They have to post and now post with more detail and be transparent about their costs. And when you go to look at those costs, you'll see that, let's just say it's the hip replacement. The cost for a hip replacement for this insurance company might be $25,000.
We had the numbers on this actually, I just looked this up. We just passed regs that strengthen, under the direction of the president, price transparency for hospitals. I just plotted this out last week on a map in Manhattan.
Yep.
The range of prices for a hip replacement in Manhattan is between $2,500 and $75,000
Yeah, it's ridiculous.
within a 3-mile radius.
But what's even crazier is anybody with a credit card can walk in and get a cash price. That's better than what the biggest insurance companies have negotiated with those hospitals, which makes no sense. So what happens next? Well, what happens next is when you get that hip replacement and it's $75,000 is the price on the website, right? Do they pay $75,000? No. Even though it's a contracted amount.
No, that is actually the insurance price.
No, I know, but they don't pay that.
Crazy.
But they don't pay it though. So they'll set it up really high like this, because then they can charge the employer $75,000, but they're only going to pay the hospital $50,000. So now the hospital is a subprime lender. They're underwater by $25,000 versus what they expected to get paid. So then that's not all. Now we talk about pre-authorizations, and we hear all the stories about denials. Denials are not about denying care, because as they'll tell you, 98% of those get paid, right? And typically it's even higher if you go out a year. But what they do is they hold on to the money and just delay, so they get the time value of money. And then after they've paid what they do pay and they've paid it late, they go back in and audit and claw back more. So now the hospitals are getting abused, and fraudulently those contracts are worth nothing, and they have to hire all these administrators, all these lawyers. So that's when you see the administrative costs for healthcare going 20, 30, 40% because of the insurance companies underpaying. And of course, when they're delaying everything because of the denials, the patients are hurt, right? The doctors have their time wasted. But because the hospitals are underpaid, clawback, subprime lenders, now they have to make up for that lost revenue. So they invent all this nonsense like facilities fees, and they'll charge more to different groups and no one gets the same price, and it's just vicious circle. So I'll say it again, the only way that vicious circle ends, oh wait.
Is Mark Cuban costplusinsurance.com?
No, never. But in any event, and I'll also add, we've heard lots of stories about how PBMs owned by the insurance companies treat independent pharmacies really, really poorly. They underpay, late pay, clawback. You know who else they treat really, really poorly other than patients? independent physicians like your dad. They do the exact same thing to independent physicians because insurance companies are no longer insurance companies. They are companies that look for the weak link in the healthcare chain, and they push as much risk down to them as possible. So the independent physician who might have 1, 2, 3, 4 docs in their practice in a small town in rural Utah, you think it's bad when they underpay the big hospitals? You should see what they do to the small physicians. And what happens when they underpay them, claw back, late pay them, those independent physicians can't deal with it. And oh, by the way, there's a lot of administrative burden in dealing with Medicare. You already know, you've already heard all that stuff. But all those costs become so high, they end up having to sell their businesses, right? So now you see fewer and fewer independent physicians available to anybody because of these insurance companies.
Yeah.
The only solution is to break them up. But to your point, Chris, we created a site. I'll keep on saying that.
You might not be the favorite sir, but you're winning the
Oh,
vote.
we're in a vote.
I think it might be coming back.
But we created a site called costpluswellness.com. And what we did for my employees and my companies, we said we're not dealing with the insurance companies anymore because of all the reasons we mentioned. And we went to the hospitals and said, all those problems you have that increase your cost, we won't do those things. And in exchange, we want a discount. And we got the discount. And we said we want one more thing. We want to be able to publish those contracts on Cost Plus Wellness so that every employer can copy what we're doing, which is leaving their health insurance companies behind because they're the devil. We don't want to deal with them at all. Right? The big ones, not all, the big ones. Right? And then get a third-party administrator to do all the claims, adjudication, and all that. And we're saving money, so much money at my companies, 1,500%, 2,000. We're saving so much money at our companies that you know what the deductible is for our employees that work through this program? 0. You know how much the out-of-pocket is always, including medications for cost plus drugs? 0. That's how much incremental cost we're going to do. So how do you change all of this to get rid of the insurance companies? Really, really, really simple. If we were to take the HSAs, which they're talking about doing, right, and disconnect them from the insurance companies, because right now you have to have a high...
Wait, say that last part one more time.
You guys are working on HSAs.
This is actually part of the president's plan.
Right, but where his mistake in that is that he wants
You
to...
can't help yourself.
No, I'm just telling you the truth. I'm just telling you the truth. You know, I'll give credit where credit is due. You've heard me say great things about Trump RX and its opportunity. But what I'm saying is, with HSAs, when you deposit money into them for people, you can't use it on insurance. There's all kinds of restrictions. But what I'm saying is, if those HSAs were disconnected from insurance, then this becomes a banking issue and not an insurance issue. So you can put as much money within whatever limits, because I know the CBO has got constraints and all that you set, and then you are saving your money and earning interest. And if you need health care, then that bank you deposited in, whatever it is, they'll loan you that money. And what that bank will also do is go buy reinsurance, or hopefully the government would step in and create reinsurance, catastrophic insurance if you want, but not even insurance, right? Just a reinsurance program that above, let's say, $20,000, it kicks in. So now you get to save as much money as you need to for forever, and in the event you can't afford your health care, just like we do for SBA loans, for college loans, for housing loans, they'll guarantee it for you from that bank. And what you've done at that point in time, particularly if you say that the money you loan can only be used for healthcare at Medicare rates, without setting price caps, you've set price caps because that's where all the money is, just like with Medicare has. And by allowing those people to go out and borrow, but it's never more than $20,000, what people forget is every penny you pay in healthcare premiums to insurance companies, you have to pay forever. You never pay it off. Even when you get to Medicare, you're still paying premiums. It is the biggest debt that you have in your life that in terms of how long you pay it. You can pay off a house. You can pay off your student loans. You can't ever pay off your healthcare insurance premiums.
But you just hit on a point around competition. So you've posited a thesis that says we got to break up the insurers. I'm going to take the other side of that coin for the sake of interesting dialogue, which is I have 68 million people on Medicare. We have 170 million that we insure through CMS. We have 3 forms of insurance in Medicare, but I'm going to simplify for a second. We have 2 forms we're focused on. We have Medicare Advantage, which is the insurance company, just like you think about it. It's United, it's Humana, it's Cigna, it's a Blues plan that's insuring people. The government pays them to provide that insurance. We also directly contract with what are called accountable care organizations, hospitals, providers, and say, you just do it, go straight. We'll go straight to you. You provide the coverage, and Medicare beneficiaries go consume your care. We put a lot of strings on them right now. We have too many regulations. We make it difficult for them to compete. But what we're trying to do, what we want, is competition. We need transparency of prices. We need consumers to be able to choose. In any other market, if a consumer chooses, I want this car wash instead of that car wash, or this gas station versus that gas station, the gas station that gets chosen against goes out of business, or they lower their prices to stay in
If you have a
business.
genetic disease, Chris, or you're in a car wreck and you're really messed up, how are you going to shop?
But we've got that sorted, right? Already you've got the No Surprises Act. You're not stuck with a bill.
So that's
You
just
can
how
go
much
out
it
of
costs,
network.
right?
You don't have to worry about it.
You know,
You go anywhere
you're
you
sitting
want.
there like this going, oh my God, somebody fix me.
You go anywhere you want.
Yeah, but you're not in a position to make a decision or look at the
It
alternative.
doesn't matter. You're guaranteed not to pay the excess cost.
So I guarantee you're guaranteed, but you're not, there's no free market there when people aren't ready to be able to make a decision.
But this is the point. Right now we talk about healthcare like it's a market. And it's not.
It's not a market.
What is a
That's
market?
right.
A market means a willing buyer and seller. We have that, right? Tyler provides services. You want to consume services.
Yeah, but it
check.
doesn't work that way.
But wait else. What does a market need? A market needs the buyer to know what they're buying. Do we have that in healthcare right now? Not really.
No.
And a market needs to know what the buyer's going to pay. Do we have that?
Right, but where you...
Other than with you and now with Trump RX?
No, you don't.
But that's the point.
Yeah, but it
so
doesn't
if you
work
want to
that way.
actually make healthcare work, you have to drive consumer accountability, which is
That all-
core to the thesis. That's core to the plan.
You can't hold a consumer accountable when they're dying and trying to figure out how to stay alive. But again, going back to what I said about insurance companies. If the insurance companies have their tentacles so far out into so many different ways, they might have pristine pricing for every single service that they cover. Drugs, service, surgeries, whatever. They're still, and you have the No Surprise Act, which is great. Congratulations. But they're still going to get you for the price of Band-Aids or whatever. They're still going to charge you outside
the point.
Nobody
You just
from
solved the
insurance is
problem.
coming out.
No one just solved the problem, and you
Of course, that's
created
what I do.
competition, right? So what's preventing the market from creating 500 of what you just did and putting competition on the insurers? What will they do? They will respond. They'll either
Well, right
get
now-
better or they'll go out of business.
Right now, it's the tax advantage that makes a difference. But your point is right. That's why we're talking about
But
it.
that's transparency and that's competition, which is exactly
Right.
what
Look,
we're trying to promote.
that's what I do as an entrepreneur, is to create business. But what I also know, like cost plus drugs, perfect example.
Yep.
Why is it, you mentioned us for generics, why is it we don't have every single medication already that's on Trump RX? Because the PBMs owned by those insurance companies went to the big pharma manufacturers of brands and told them literally, if you work with cost plus drugs and give them the equivalent of rebates, give them the equivalent opportunity, not even at the lowest price as
We
all
won't
the
work
big-
with you.
We won't work with
Yeah.
you, right? Fix that, and all of a sudden, you know why they don't want the big pharma brands to work with us? Because they know that if we get anywhere near the rebates that they do, we'll show you the net price like we already do, only market up 15%, publish it, then just like we saw with specialty generics and now with biosimilars, every single corporation of, even like public company or public government organizations and state organizations will use us as a pricing benchmark.
But that's the point. Transparency drives competition.
Right, it's not just transparency. When you have somebody who has regulatory capture, like those big three insurance companies who own those PBMs and just say, screw the patient. Let me just tell you, those big insurance companies are too big to care. They are so big, there's no amount of competition that will change that. I can't compete with a $200 billion company, or even bigger than $400 billion company, who says, you know what, big brand manufacturer, you're going to lose tens of millions, or hundreds of millions, or $1 billion because you work with Mark Cuban. I literally talked to the CEO of a company, and I said, of a big brand company, and I said, one time I did an interview like this, and I said, if the big PBMs are telling you not to work with us, smile and shake your head twice. And he was like, they would never do that. And then I went and talked to another pharma PBM and brand manufacturer, and I said, okay, how many lives do we have covered? There's 80 million out there potentially from the big 3 PBMs. How many do we have to have covered in order for you to sell brands to us, your brands? Half. Because we're going to lose too much money, Mark. We're a public company. We can't do it. So when you say it's a free market, it is not a free market when the biggest players get to say,
and I want to call this out because not everybody here is in healthcare, but there is a point that's relevant, and I have a call to action, which is you should be, and if you're thinking about building something, I want you to be. The government isn't going to generally solve problems. We know that. The government's role is to create an environment in which you all, as insurgents, you as an insurgent, can challenge incumbents on a level playing field and solve problems. That's free market enterprise. That's free market principle. But then it's true. And so this is the question. You have a bunch of people, what am I doing as an entrepreneur who builds businesses, sitting running a $1.1 trillion budget for the government? This was not my hope and aspiration growing up. But this is the question. So you're sitting saying, I don't have a level playing field.
Right.
And many of you might be sitting and trying to sell business or build businesses right now and feeling like you don't have a level playing field. I had this reaction in healthcare a couple of summers ago. I was sitting there realizing, I was in a room with a bunch of entrepreneurs, I was looking around at all my friends and realizing every single one of them was going to need to sell through to a customer that was an incumbent hospital or health system or an incumbent insurer, which meant they were going to have to bastardize their business model and their revenue model until it was acceptable to the incumbent to entrench the incumbency. And then a bit of a horrifying response, which was the only stakeholder in the entire healthcare economy of $5 trillion that didn't care about that incumbency, that only had 2 stakeholders, patients and taxpayers, to care about, was the US government. It could actually be the most innovative and take the most risk. But you had to have people who understood entrepreneurial principles and wanted to let the free market do its thing. So that's my question, and that's my question for you, which is bring your ideas. It's easy to sit and say, break them up. And sure, maybe that's an answer, and that happened with the bells.
Think about what you said earlier. You said our healthcare costs were getting so big.
I agree.
And the debt is getting so big that the viability of the USA is at stake.
Yes.
Now, our debt is growing so fast. Then it's just a question of timing, right?
That's the point. I need you, and I need a bunch of you, and I need a bunch of you who are thinking about doing this thing to show up and actually challenge the incumbents. And what happens when an insurgent challenges an incumbent? One of 2 things happens. The incumbent goes out of business, or they become an insurgent themselves.
No, or they step on the competition.
No. That's cheap. Our role has to be, this has to be the mandate to level the playing field. That's my point. And
so no company should ever be broken up ever.
What do you want us to do? That's an option. What else? What policies? What
here you go. Right, here you go. So number one,
too weedy because not everybody is in healthcare.
Really simple. Number 1, make all pricing at net. I'm going to show you how stupid the
farm. Don't go weedy.
No, I'm going to show you. This is the easy example. I'm going to show you how stupid the pharmacy industry is. Right. So in any business, you come on Shark Tank and you say, I'm selling hammers. And I'm like, where do you buy your hammers? And Mr. Wonderful says, I want a royalty. But I'm like, where do you buy your hammers? And they say, we buy them from the wholesaler. And I'm like, what's your margin when you buy them? 50%. We sell the hammer for $29.95. We buy them for $15. Great. We'll see if you can sell them. In the pharmacy business for brands, the wholesalers pay retail for their drugs. So that brand medication that you're selling, right, you had to do all these little gamesmanship.
And that's a policy change. Require that pricing.
There you go. But now you're stepping in. I can't compete against that at all, right? Because let me tell you what happened. If you were to change it so that, I'll use the old price of Eliquis since it's the most widely prescribed drug, and to BMS's credit, they reduced the price, and you guys had a lot to do with that. So they deserve a lot of credit for that. Right? That's great. But if the price of Eliquis was sold at the net price, to the wholesaler of $300 after rebates, which is the price after rebates and fees. Then the wholesaler would sell it to the pharmacy at $330. They made $330 the old way, they can make $30 again. Now the pharmacy only paid $330, so when then somebody is in their deductible phase, walks in to buy Eliquis in December of 2025, the pharmacy can say, okay, I've paid $330, I'll sell it to you for $340, and actually make money, as opposed to the way it is now. Believe it or not, when that pharmacy sells it at that higher $600 price, they have to get reimbursed by the big insurance companies I want to break up and their PBMs. You would think they'd reimburse them for their cost, and you guys are trying to change that, but they don't. They under-reimburse them, less than their cost. And so, the one thing that you can do, in addition to the deductible phase like you're talking about, make all pricing net. Right?
That's the point. That's the kind of thing we can do that levels.
But it's the same thing!
It's called policy. And these are the tools that we have to work with.
You all could go on forever.
Yes, and I love talking to Chris.
That would keep me here all day. We could go back and forth.
And everybody's like, and we're not really.
No, because there's an audience of one also paying attention.
But the part I want to end with is like something that I've learned about life is that you can do well financially in a lot of ways.
Yeah.
There's a whole lot of ways to make money, but this premise of doing well by doing good, and like as you think about your life right now, like how are you defining success? Like what do you look at as like your North Star in terms of who you want to be and how you live your life for both of you?
Convincing him to break up the healthcare insurance.
I think we're going to need to go 1 or 2 good years about that.
No, I give Chris credit. I mean, we give each other a hard time like this even when we talk on the phone. He's smart as shit, his heart's in the right place, and he wants to do what's best for the country. And that's all you can ask for from anybody.
I was doing well at Bain Capital. It was a great job. My wife was 8 months pregnant. She was finishing her graduate work. I had that envy that I told you about. And I was knocking on a seat in the partnership, and it was going well. And I remember coming home and we're doing dishes in our little kitchen in our brownstone in Boston, telling her that I wanted to leave as soon as she graduated, and about a month before we were going to have our first child, because I wanted to build.
Yeah.
And I wanted to go with this, my buddies, and build this company. She asked this question that only spouses can ask. It's always the right piercing question, and said, okay, take off your investor hat or your entrepreneur hat for just a second, put your investor hat on, would you invest in this business? And without thinking, in my mind, my mouth just ran, it vomited out. It's like, absolutely not, it's categorically uninvestable, nobody would invest in it. It had regulatory tailwinds in our one market, we've got one product, and even if we scaled across the whole country, we'd only make about $70 million, and we probably wouldn't break even. And then my brain caught up, and I was convinced, I'm trying to stuff the words back in my mouth, and I'm convinced she's gonna say like, no way are we gonna do this. And in an amazing testament of her support, she said, okay, I'm totally behind you. I just wanted to know. And then we went for it. I was driven. There are a lot of ways to make money in life. There are a lot of ways to make money in healthcare. Don't waste your time on things that don't make the world better. Alleviate human suffering. That is an opportunity. That's the life well lived. You can make money as a shark. You can make money owning basketball teams. You can make money selling your startup. I guarantee, if you're so lucky to have a few seconds before you blast off from this life and think back to everything you did, the thing you're going to be most proud of was human suffering that you alleviated by enabling more people, more Americans, to have access to affordable health care. And that is the thing that drives me. It's why I'm in this job. It's why I don't generally see my wife and my 4 kids almost ever right now. I have never worked harder in my life. I have never sprinted faster. By the way, trying to keep up with the president, who sprints faster than everybody. He's incredible. Because there's an opportunity to do the right thing. We are our brother's keeper. And there are plenty of ways to make money. Do it, but do well and do good. That's so obvious and so easy. And I think it's in our DNA in Utah. I think it's our culture. We are a community that lifts one another. We don't compete. You know this. Look around. You see competitors in the room and you help each other.
I showed up to town, and I remember people who had no business spending time with me showing up and helping me and making introductions and giving me ideas and introducing me to investors, helping our company that didn't deserve it, because that's what we do. So help one another. Do what by doing good. It's what he